stroke exists. The thing is, it's less known. Heart failure, everybody knows. Chest pain, radiation of pain in your arm. It's recognizable. Stroke in some countries is seen as the spirits they're bad spirits. It's not so clear. You're tuning down, your brain doesn't work anymore, brain failure. That's major, and it has such an impact without you feeling alarmed per se. 10 years ago, there was a revolution really in stroke. There were 5 publications at the same time published in a New England Journal of Medicine that proved that removing the clot with a catheter out of the brain could reverse the impact of a stroke, could really take out that impact if provided well under the right care. And that was really major. I'm showing a picture here of something pretty revolutionary as well. 100 years ago, Alexander Fleming, he invented penicillin. That was at the time, for pneumonia, the #1 cause of death. And penicillin was able to cure that. And why I'm showing this picture is that actually there's really quite a similarity to the impact of the treatment of stroke that is possible through mechanical thrombectomy, what we just talked about. And to explain that, I'm going to show a graph to talk about the number needed to treat. Number needed to treat basically is a number that indicates how many patients do you need to treat before you get a good outcome or prevent a bad outcome on one patient. And just too illustrative. Of course, lung cancer screening, you screen a lot of people to find one lung cancer patient, and that's logical. Number needed to treat, 219. We spoke about acute coronary syndrome. The number needed to treat to intervene, to perform an intervention on acute coronary syndrome to avoid death, myocardial infarction, or stroke is 39. Alexander Fleming, with his invention on antibiotics for pneumonia, number needed to treat 6, a really high number. The 2015 papers on mechanical thrombectomy that showed that mechanical thrombectomy was effective to reduce disability is 2.6. This is unheard of in modern medicine. It's a major breakthrough to get this treatment done. So today, stroke care, and I'm speaking stroke care as a whole, so also thrombolysis treatment, which can be life-saving and disability-saving as well. Less than 5% of all patients get stroke care in the world. If this would be the case for other non-communicable diseases, it would cause an international outcry. It would just not be acceptable. And for stroke, it's a postal code lottery. Where do you live? That determines how good your outcome chances are. So is it the cost that is preventing this? We have extensive studies in high-income countries, but also middle-income countries like in Brazil, showing that it is highly cost-effective and in some cases even saves money to a country if you would invest in providing this comprehensive stroke care.
We also need to look beyond costs. I mean, if we look at sort of, for me, one of the things that we're working on actually in the industry and trying to think about how we do this with others is getting others and governments to understand better the return on investment when you take an integrated multimorbidity approach that includes prevention. And I think that's important because we're still far off the mark in terms of how much we're investing in primary and secondary prevention. We also need to look at access much more holistically. I was really blown away by the fact that in 2017, 21% only of LMICs, low and middle income countries, had a CT scanner. And I understand that in stroke, a CT scanner is a really crucial basic diagnostic tool. And that, for me, really says it all. I think we need to find ways, whether through universal health coverage or elsewhere, to help countries understand how we can make more investment in some of these areas, knowing full well that, this is a fully interconnected agenda. I think I read also that somewhere in between 5 to 30 times greater is the risk of stroke you have if you have chronic kidney disease. So this is just to illustrate, it's really a joined-up agenda, but we're missing that interconnectedness.
With 100 days to the United Nations high-level meeting on NCDs, find out how you can get behind the call for stroke action now and help put stroke at the top of the policy agenda.